welcome to Bridging the Gap. I'm your host, Todd Johnson, and welcome to the show. Today we're talking about people who care for the aging. And having said that, our first guest is Rick Spector, who's the Director of Community Relations for the Philadelphia Corporation of Aging, also known to many of us as PCA. Rick, welcome to the program.
Todd, my pleasure to be here.
Well, we're going to dive right into it, Rick.
Fine.
A lot of people, myself included, know about PCA, but we may not know about the plethora of services that your agency provides. Could you just give us an overview of what kind of work PCA does?
All right. Our mission, Todd, is to help older people, disabled people remain in the community. That's where people do best, near their family, their friends, their church. So we fund a variety of services to help keep people at home, including things like senior centers, legal services, transportation, health insurance counseling. We have lots of programs for shut-ins, and we also advise people about their benefits and rights. Lots of great programs under the Pennsylvania lottery. So there's lots out there to help keep people at home.
Now, your work with PCA, how long have you been affiliated with?
I'm going to say 30 years, Todd. December 7th, D-Day, 1981. That was my first day at PCA.
Wow,
great. Long time ago.
So you're an old timer with PCA?
Yeah, I came when I was 8 years old. Oh, no, only kidding.
A lifer, right? Now,
yes.
your work with PCA, I know many of the people who live in the neighborhoods like I do, sometimes we see the PCA truck with the Meals on Wheels.
Yes.
Could you explain that program to us?
Sure. We're actually the second biggest provider of meals in Philadelphia next to the school district. So if a person is a shut-in and has no other means to have a prepared meal, they can apply to us through our helpline, which is the gateway to all the services. And we would do an assessment and try to hook them up with our home delivered meal program. If we couldn't help, there are other meal programs in the city. We also try to get people out to senior citizen centers to have a meal, to be with other people too. So we try to keep no senior citizen from being hungry in Philadelphia.
That's great. Now, are there certain guidelines that a person would have to meet, or certain criteria in order to be eligible for the services that
They really
PCA
vary,
provides?
Todd. It's a good question, so people should call us. Well, you do have to live in Philadelphia. Most of the programs start at age 60, although there's some exceptions to that. For a few programs, there are income guidelines, but the important thing is never exclude yourself and say, I'm not eligible for this or that. Give us a call at our helpline. We may be able to find something for you. And if I could plug our number.
Sure, you can.
215-765-9040.
Say that again for us.
215-765-9040. That's the helpline.
Is there a website address?
Yes, pcacares.org.
PCAcares.
www.pcacares.org.
Thank you.
A great site.
Now, I know in the PCA community you deal primarily with seniors. What type of services do you provide that the general public may not know? People like myself, whom I'm not the age requirement, but who may not know some of the specific services that you might provide for seniors.
Okay. Well, for instance, if a senior is looking for employment at the age 55, starting, we can help with job counseling, job placement, and job testing. Just giving you a few examples. If they want to be with other people and eat a meal, socialize, take a class, there are senior centers. We have a home repair program, a minor home repair program that starts at age 60. Most of the programs for shut-ins start at the age of 60. They include social work services, home health type services, home delivered meals. Elder abuse services start at 60. Really, anyone can call us for information.
So you offer a wide range of services for seniors.
Absolutely. Anything designed to help keep the person at home. That pretty much falls into our domain.
I had a question that I've never had the opportunity to ask someone from PCA. When and how did PCA start?
Okay, well, we started way back in 1973. We actually came about as amendments to the Older Americans Act to set up the Area Agency on Aging. And we're authorized by the Pennsylvania Department of Aging to serve the city of Philadelphia to help seniors to remain at home. We're a private, nonprofit corporation. We're the biggest area agency on aging in Pennsylvania and one of the biggest in in the country. Serve about 100,000 people a year.
That was my next question. How many people do you guys serve?
Lots and lots of them, 100,000. And there are more people turning aged every day, so we have whole new cohorts coming to our agency to find out what's available.
Yeah, I read that the largest growing community in America are seniors.
That is correct. Growing very, very quickly.
And people are living longer and healthier.
People are living longer. You know, years ago, people used to pass away from diseases that they have miraculous treatments for today. So people live longer, but not necessarily always better. So we try to fill in the gap with all types of good programs.
So having said that, do you see PCA as a entity that will always be around because of the population you serve?
I hope so. I hope so, Todd. I hope our founding fathers and mothers have the vision to keep organizations like us funded and growing. It's been a struggle the last few years because of the economic downturn, but we have ups and downs over the last 35 years or so, but we're always there to serve. People should call us.
Now, I know for myself, I'm not age eligible, not even for AARP. I was told I have to wait till I'm 50.
That is correct.
In order to be a full-fledged member. So I'm waiting for those 2 years to pass with tiptoe anticipation. But I would only assume that PCA, you mentioned the age being 60 and above.
In the main, it's 60 and above. But for instance, at age 55, you could apply for employment programs. At any age, there's a wonderful volunteer program called Little Brothers Friends of the Elderly. If someone of a younger age wanted to volunteer to visit a shut-in, you could do it through that program. So there's numerous opportunities, even if you're not of that senior age, so to speak. So
you would say to me and to others who might be watching this program, who are younger than I, because I'm certainly not a young man anymore, that you do intergenerational activities?
Absolutely. We work closely with the Temple Intergenerational Center. They have a great program called Temple Time Out, where they hire younger people to visit shut-ins, to provide respite services. So there are lots of ways that we can connect the different generations.
That's amazing. And I will probably become a recipient at some point of senior care services if I should be as lucky to live so long. But
I hope so, but give us a call.
Yeah, but I guess when I hear PCA, now there was a nasty rumor I heard many, many months ago about PCA, and could you dispel that for me? I heard that people's homes were getting taken and all that kind of stuff.
Okay, let me explain that. We have a home care program called the Waiver, where people get assistance at home with various home care tasks. The Waiver is funded by the Department of Public Welfare. This is not PCA's idea or program, but if you get waiver help, there's a program called Estate Recovery, where when you leave the program, the state can go after one's assets, your home, etc., to pay off the cost of the home care. We have about 8,000 people in the waiver program, despite the estate recovery. What we do is advise people when they hear about the estate recovery, quote, my home's going to be taken away, get some free legal advice through one of our vendors, because their exclusions, of course, while you're in the program, your home would never be touched. Their hardship waivers, there's different clauses that can protect oneself, and you should get legal advice before you enter into the waiver program. So there is some truth to that, but there's good, sound legal advice to help you deal with it.
Now, you mentioned that you have younger people who volunteer, and some who are paid, I guess, to work with the senior community. Do you have other seniors who perhaps are not recipients of PCA but would volunteer their time?
Yeah, we work with the RSVP, the Retired Senior Volunteer Program. That starts at age 15. You can volunteer as little as 2 hours a week, maybe to work in a museum, to work with children, to work at the zoo. So you put something into it, and the community gets something out of it. It's a really wonderful program.
So that's a viable program that you have?
Absolutely. That's been around forever, and we hope it continues to be.
Because I'm looking at you, and I'm saying, this guy looks like a baby boomer as well. Well, I think both of us are in that baby boomer bracket.
I'm maybe a little older baby boomer than you, but there's lots of great ways to get involved out there to help keep you young.
Because as a baby boomer, when I think about caring for the aging, it becomes more relevant with time that I might be a recipient of the care that your agency provides.
Right.
And so I would only think that you would want people who are not seniors to also become active or become involved or get information for perhaps their senior parents.
Yeah, and most people are very, very interested in providing care for their loved ones. It's just, people need the means. And the means is to get on the horn and call us and find out. You know, you can't find out about the program so easily in a telephone book or to ask your minister or your politician. That's why we're there at the helpline. 215-765-9040.
Okay, 765-9040.
You got it.
And the reason I stress the telephone number, a lot of seniors may not be as inclined to go online.
That's true. However, there are growing numbers of seniors who are into the web. You'd be surprised. That's growing too.
Do you guys provide any type of class?
Yes, at our senior centers, one can learn the internet, basic mousing and manipulating the keyboard. We try to keep people in touch with the digital age too.
Wow. Now, personally, what kind of reward do you get for caring for the aging community?
Well, it's a feeling of satisfaction, Todd. I was trained to work with children, believe it or not, a million years ago. And I didn't feel my efforts were always appreciated for a variety of reasons, but I just feel working with seniors, they're the most appreciative of any group, the most grateful. They don't seem to have that axe to grind by the time you reach that senior age.
I have found that to be true too. As you can look at me, you can tell I frequent some fast food restaurants, and I notice when they have seniors working at some of the fast food places, they are the most kind, gentle,
mellow like you.
Right, mellow like myself, who just provide that
Yeah,
service
if
that
you live
can't
that long,
always
you
get,
have to roll with the punches, so to speak. That's what keeps you going.
Well, I want to thank you for coming and sharing with us and continue great work at PCA. Rick Spector, Director of Community Relations. Thank you, and continue success. Don't you go away. Stay tuned. We'll be right back after this commercial break. Bridging the Gap. I'm your host, Todd Johnson, and we're talking about those who care for the aging or the elderly. We have with us today Joan Raftery. She's from the Visiting Nurses Association. Joan, how are you today?
I'm great. Thanks for having me.
Director of Chronic Care, is that correct?
That's right.
Now, Joan, VNA, I know a little bit about it, not an extensive amount, but could you kind of give us an overview as to the scope and mission of VNA?
Sure. Visiting Nurse Association of Greater Philadelphia. Actually, we just celebrated last October our 125th anniversary.
Wow.
We are the second oldest visiting nurse association in the country. By 2 weeks. Boston has us beat by 2 weeks.
Wow. I hate the Celtics too, so I have no love for Boston. But
we service the entire Philadelphia area out into the counties. Our mission is to provide quality home care to all individuals, regardless of their insurances. We get referrals from many different sources, from physicians, from hospitals. We work with a lot of different hospitals. We're not associated directly with any one hospital, but we do get the majority. At any given time right now, I believe we're servicing around 1,300 patients in the area. Our services are not just exclusive to nursing. We also have a rehab department, which we provide physical therapy, occupational therapy, speech therapy.
wow.
Additionally, we also have a hospice division, which cares for those that are dealing with the end-of-life issues.
Right.
And that our hospice has clergy available. They also have different therapies. We have a dog therapy.
Wow.
Music therapy.
Could you explain that, dog therapy?
Well, we have a therapy dog. Actually, our director of rehab, Deborah Mondoyle, her personal dog, she went through the training with her dog Rex, and they became certified. And on Fridays, she brings Rex into the office, and then she volunteers her time in the afternoon and goes up to, we do have an inpatient hospice unit. And she goes up and visits with the patients.
Wow, with Rex?
With Rex, and it's extremely well received. Really very well received.
I never heard of that before, dog therapy. Okay.
We have musicians.
Really? Do they actually play in the hospice, or do they play
Yes.
Wow.
Yes, they actually do play in the hospice. The chronic care team has 3 subspecialties, which broadens the scope of what we can handle. We have nurses that are specially certified. They're chronic care certified by Health Sciences Institute. And we have a congestive heart failure COPD program. Additionally, we have just 1 year now have a palliative care program, which is a program that deals with those that might have a terminal illness or an end stage of an illness that are still seeking treatment and require maybe a little more TLC, their comfort care. We try to manage their signs and the symptoms of their disease process a little more intensely.
Now, at your work at the VNA, do you deal primarily with those who are aging, or do you deal with another section of people who perhaps may not be up in age but may have certain physical limitations?
There are, of course, the elderly are you know, sometimes the ones that wind up as we age, we accumulate disease processes. But we do care for a broad spectrum. We will sometimes have younger patients. We will have disabled patients. Most are homebound.
Right.
And we do an awful lot of coordination, and from a nursing perspective, we do a lot of coordination to get things, sometimes psychosocial issues that need to be addressed, to coordinate, to get things in place so that the main objective for patients is everybody wants to remain independent. We want to foster that and get them what they need to remain in their home.
Now, I also know, I did a little homework, that you were once a frontline soldier as a nurse, that you started in the nursing program and then later on became an administrator quite recently, right?
Yes.
You want to share that with my audience?
Well, it was
the trajectory of where you were to where you are now?
There have been great benefits in that. In being a frontline soldier, as it were, it's given me the opportunity that now being on the other side of the desk, I have the ability to appreciate what the nursing staff, what any of the staff goes through on a daily basis, and the obstacles that you can run across in trying to provide home care, you know, to the community.
Now, your community, you serve the Philadelphia general area?
We do. We service all of the Philadelphia area out into the counties, Delaware County, Montgomery County, Bucks County, Lower Bucks.
Now, the care you provide, I know you said you service about 1,300?
Right now, I believe our census is about 1,300 patients, active patients.
And that's done annually. You guys know how many seniors you service on an annual basis?
Well, that number will change based on the amount of referrals. Patients go into the hospital, then they're coming out, we'll get a referral, or even simply a patient will go and see their physician, and they'll make a medication change. A simple thing is a medication change, but you have an elderly woman who lives by herself. She has hypertension, perhaps. Medications get changed,
right,
and she might need a little bit of help to make sure that she takes the new medications or the changed medications properly. So there, the nurse will step in, the referral will come from the physician's office. Let's get in there and see what we can do so that we don't wind up with hospitalization,
right,
simply because the medications were taken incorrectly. And that seems to be one of the biggest reasons people wind up at the hospital,
right,
is because they're not taking their medications properly, they don't get them.
Right. Now, kind of walk me through that then. You get a referral from the doctor, you look at the referral and you go to the person's home, you do that initial visit. What might transpire between you and the potential patient at that time? Will you try to find out what type of meds they're taking and so on and so forth?
Typically, when we go out to do an admission, one of the first things we do is we explain the role of the nurse. And one of the first things that is done is, say the patient came from the physician and there was medication changes and perhaps there were prescriptions.
Right.
So what we do is we will look to see the medications that are in the home, try to reconcile those to assist, and then we instruct. Nurses do a lot of instruction and a lot of education to assist the patient.
Yeah. When you're not at the patient's home, is there some type of mechanism, follow through, that you make sure the person is indeed taking their medications regularly on time and so on and so forth? How is that process?
Well, typically after the nurse makes the visit, there's a report back to the physician to advise them that we're trying to get things in play, confirm what we call the plan of care. We will make, if someone comes out of the hospital, ideally we try to make 5 visits in a short period of time to make sure that things have been put in place, that they did get their medications upon discharge, and assist and coordinate to, if they didn't, to get that, and also to help them make their follow-up appointment with their physician,
right,
to keep them on track.
Yeah, I know of your work because my mother was a recipient of VNA, so I knew firsthand. I call them Angels of Mercy, a plan of care as you call it, but the work that you guys do, both from the nursing standpoint and the physical therapists who come in, is just absolutely astounding. And if somebody wanted to get in touch with the VNA to see if they were eligible for the services, or they go to their doctor, what number would they call to get in touch with you guys?
Our main number is 215-473-0776.
Would you repeat that for me?
215-473-0776.
And if they want to go online?
Online, we are vnaphilly.org.
vnaphilly.org. Well, that's wonderful to know that there are Angels of Mercy in the agencies like VNA caring for the elderly and giving them that independence, because you guys generally go to the person's home and they're able to keep their dignity and independence where they don't have to be admitted into a hospital. So you try to prevent that from taking place by making sure they stay on top of their care. That's wonderful. And Joan, I've heard a lot about you too, so everything I've heard was just absolutely positive.
Thank you.
And I thank you for being here today.
Thanks very much.
And I thank you all. And again, when one's on the right, another's on the left, when we reach towards the middle, we begin to bridge the gap. Until next time, love somebody and be nice to everybody. Bye for now.